started. It's 10:01 and I want to respect your time. So if for those of you who don't know me, my name is Susie Johnson. I'm the project manager at the New Mexico Alliance of Health Councils, and I work specifically with the CDC DOH Kellogg Vaccine Equity and Community Rebuilding Project. I have helping me Geraldine. She's kind of helping on the back end. Geraldine. And Geraldine is our tribal liaison, super supportive of me and just really supportive of our tribal health councils. So once again, I will ask if you could put your name, your role, and the county that you represent in the chat. And the way that this is going to go, it's very informal. We're just like, imagine that we're all like, I don't know, in a coffee shop, just chatting, and we're asking questions and we're kind of going over some stuff. So I'm going to share a slide presentation, and it's going to go over the two-step reporting process. And it's also going to go over some other useful information. Then we're going to do a question and answer. I'm going to address one or two questions that we didn't cover in the presentation that happened in the last training. And we will open it up for you all to have questions. And then we're going to introduce our guest speakers. We're very excited. This is only our second time doing this refresher course. It only lasts an hour, but this time we invited Joan Goldsworthy-Appel and Emily McRae to help us with data, because I am not a data person. So if you'll notice, and if you've ever asked me questions about data, I'm like, Joan, Emily, please help me, because it's just not my thing. But I love it, and it's important because this work is really meant to be long-term, and it's about finding data to reach your vaccine equity goals, but it's also about showing you how to use the dashboard for future work. All right, so they will take the last end of the training, so I'm going to get started. And I just have to say, forgive me for talking fast. I talk fast. That's just how I am. And also I feel like I really want to get a whole bunch of stuff going here. So I'm going to start by sharing my screen, and I will let Geraldine let everyone in. And just one second here. Okay, go into slideshow. All right, so I use this first slide not just as a title slide, but also to make sure that when you're talking about this program, that you're calling it the right thing. It was funded by many different organizations, three mostly, CDC, DOH, and Kellogg. But that makes this name that's already long even longer. So just for the purposes of naming the program, if you're ever referring to it, it is the CDC Health Equity and Community Rebuilding Program. All right, so let's get started. All right, so this gives us a bit of context. We covered this last time that we talked about it, but I really want to focus on the fact that, this project that was started, it's very complex. It is very important work, the most important work that I think will do in my lifetime. We've never had a pandemic like we're having now. And what happened is, I don't know about y'all, but I feel like 2019 was just yesterday, because 2019 was when life was kind of normal as it can get. Then the pandemic hit, but something important happened in 2019. Legislature passed a mandated role for health councils and tribal health councils. And sometimes we don't talk about it enough, but it's really important. They're requiring and having expectations for health councils to do work around comprehensive planning around public health, yet unfortunately, there was no funding for that. And so that's why we jumped on this opportunity to contract with the CDC, the DOH, and Kellogg, and that you guys, I hope, contracted for the same reason. It's because we need to show the work that you do and highlight it so that all the funders and legislative decision makers can see that you're doing this work and it needs to be funded. And so always think that whenever you have something to turn in or another form to fill out, it's because this is for long-term planning, and this is building your capacity as a health council so that you have all the tools so that you can fulfill this requirement. You will get a copy of this slide, and so you can click on these things. We won't have time to do it now, but you will be getting a copy of this presentation, okay? All right, so next, I just wanted to quickly go over the trainings. They are called Training and Technical Assistance. They are held on the first and third Monday of every month from 1 to 3. We recently implemented, we will now be getting a little bit of a break. We heard you, health councils, and for many county and I believe tribal as well, are sometimes they shut down their offices on federal holidays. And so it was just made sense to go ahead and not have trainings if they fall on those days. So we will either skip it all together and stretch out the trainings to give you the support that you need, or we will replace it with like maybe another day of the month, but you will have advance notice. For the most part, these are the days that they're held. The Zoom link never changes. And here's the meeting ID. Again, you'll get this so you can copy it. I would keep it somewhere. You do have an option every time we invite you to add it to your calendar. So you can do that. All right, and then when you get a copy of this presentation, you can click on the future training so you can kind of see what's in the works. All right, so this reporting process for the CDC Health Equity and Community Rebuilding Project is 2 parts. The reporting process is 2 parts, and the monthly report form is part 1. And in that report form, you will be putting in deliverables. Now, if you're brand new or you just got your hours increased and you're now trying to focus on this project, and you may have other projects going and it's kind of hard to keep it straight. So we wanted to start with this screen just to let you know. Now, it seems like it has a lot of complex information on it, and I hope that you do go back and read it. But I just really wanted you to visualize the 3 deliverables that we're focusing on in year 1. Year 1 ends in June 2022, and it is really around vaccine equity and building your capacity and figuring out where your strengths and your weaknesses are. And so these are the 3 deliverables that we have discussed already. All of them have been discussed. When we first started the program, it was about health equity committees, and it will be from here on out. Most really, I think there might be just a couple that are coming in brand new that haven't established one already. So everyone is doing well on those. In the monthly report, you will be submitting the roster. Once you've submitted the roster and it is complete, you don't have to submit it again. From then on out, you will be submitting your minutes for your health equity committee meetings. I will touch on those real quick. You have the option of doing it however it makes more sense to you and doesn't add more burden, but you want the work to be meaningful. So some health councils have said, no, our entire health council membership, they are very active. So our membership is going to be our health equity committee. That's fine. So when they're deciding to meet, maybe the thing that makes the most sense for them is to meet when they're meeting in their regular monthly meetings. But what you would do then is just make sure that you're sectioning off an item on your agenda to talk about health equity and the work that you're doing. And in that part, you want to give updates on how you're making sure that everyone in your community, not just the folks that live in the county seat, but rural, elderly, homeless, everyone is having access to the resources that you're providing and the outreach that you're trying to do around vaccine work and future work. So that's really the updates that you'll be giving there. And you can include that as a section in your monthly minutes that you have for your health council every month. So that's one option. You can also meet after, like if your group is smaller, then you could meet after that meeting since you're already there, whether it's on Zoom or in person, whatever is safe. And then another option is some health councils have chosen to just completely select another day and meet that way. Keep in mind that your health equity committee doesn't have to be a certain amount of people. The goal is that you're wanting people that are always saying who isn't being included. That's it. All right, so then the next deliverable is about vaccine equity. We started this in December. If you have questions about the actual template, I will save those for the end. But really, I think by now, everyone has been doing the vaccine work. So that will be uploaded as well. And then we recently started the capacity assessment. Nothing to upload just yet, but please join all of our trainings. But the one on March 7th will teach and guide us on how to talk to our health council members about the results. All right, so these are the 3 things that you will be putting into your monthly report form that we're going to go into next. Just keep in mind that you don't have anything to upload for the capacity assessment just yet, but it's coming. All right, so moving on to the monthly reporting form. And I forgot to mention, if you are not speaking, if you could mute yourself. I forgot to mention that. I will hopefully not have to mute myself because my dogs sometimes start barking. So my fingers are crossed that they behave. All right, so this is what it looks like when you click on it. It's basically a Google form. If you've not ever used one, it's best to open this link on a Google Chrome browser or use a computer where you easily access other Google tools. So if you have a Gmail and you use it on your laptop, then you likely will not have any problems because it'll recognize. So far to date, we have not had anyone that has had issues. They did at the beginning because the computer they were using, maybe it was a state or tribal computer and they had struggles with it. So yeah, just you need to be able to use a computer that allows for Google. The alternative is to fill out a paper form that we have, but we've never had to use it. I'll tell you, I shared it with a couple of health councils and they were like, oh, it takes really long. It's very time consuming. So they were able to get creative and find a computer that they can use to do the reporting. All right, so, but if you need any troubleshooting, please let us know. I'm going to go ahead and click on the link, but real briefly, these are the 6 areas that you will be touching on in this report. And so I hope that you can see, I believe that you can, somebody let me know if you can see the form.
Yes, Susie.
Thank you. All right, so for the sake of time, I kind of pre-filled this out, but please put in, I noticed as I was doing this that I put a typo in my email. Don't do that. If you put a typo, you're not going to get the response back. So I'm going to go in here and fix my little typo. That's an old email address that I don't use anymore. But anyway, so yes, don't put in 2 email addresses, 1 email address, because otherwise it won't work. So what you can do is if someone else wants it, maybe a supervisor or someone from the DOH team wants it, then you could just forward them your email, but you just want to stick to 1 email here. All right, here you're going to select the health council that you represent. I added a test section for myself. So you will select that. You will report every time you're reporting for a new month, then you will use this drop down and select the month that you're working on. So many of you, if you're new, not many of you, but a few of you, if you're new, you're going to start with October, and then you're going to find closure to it, and then you're going to click on the link again once you submit October, and then you're going to start with November. If you try to do several at one time, it's going to kind of mess you up. So finish one, find closure to it, submit it, and then you could start on the next month. Otherwise, it's going to mess you up. So many of you will be starting to report for February. I'm going to use October just, for the purposes of this little sample here. All right, so let me see if I can make this a little bigger. Part of this project is to highlight the work that health councils are already doing. This is so that we can start planning for legislative decisions to be made for long-term funding and long-term support that health councils have not had. So it's really, really important that you highlight and celebrate the things that you're doing. It doesn't really matter what it is, but we really want to celebrate with you. It would be ideal, though, for the purposes of what we're trying to do long term, to make sure that your celebrations obviously are around public health. It would be ideal if they were related around vaccines or anything about the project. But again, really, you can put as much text in here as you want. So please share, because we want to celebrate you. So here's my example. I put, we had excellent turnout at our health fair and were able to get 25 people vaccinated. Now, I don't care if that number's 8. It's a celebration because we just want people to be vaccinated, right? So that was just an example. Another example is this month. Now, remember, when you're filling it in, especially if you're doing catch up, you want to put the celebration that matches the month that you selected, right? So let's say you hired somebody in January. You would have put, this month we hired, oh, I'm sorry. So let's say you want to say that you signed the contract. So you make sure that you put that in the month that matches. So if you signed in February, you will put that for February. If you hired a project coordinator in January, you could put that as one of your celebrations. And then once you put something like that in there, you don't have to put it in again. You just really try to focus on the month that's happening. Unless the celebration happened more than once, then please share. And then the same thing with challenges. Many of the challenges have already been voiced to us, and as a result, we tweak our trainings. We try our best to make things easier. So please make sure you're letting us know what's going on. So here, my example is our health council had trouble understanding the vaccine template. Okay, so that helps us to know, oh, okay, we need to get on that. I did a typo here again. I don't know why I keep fixing it, but it doesn't fix it. Darn spell check. So another example would be our office shut down due to COVID. Now that creates challenges and you would want to go into why, so be as comprehensive as you can without overburdening yourself, but you're just really wanting to keep in mind that not only the Alliance, but the partners that are helping us and the funders will ultimately be seeing this work. And so you want to let them know, what is the reality? What challenges are you having? I'm going to make this a little bit smaller so that we can go on to the next one. This is a question about staffing. If you answer yes, make sure again that it matches the month that you're working on. So for example, I won't go in and answer all this, but putting, John Doe, and then you're putting the positions. Please remember that, let's say you have a volunteer member in your health council and they're so helpful, but you got this funding and maybe you want to contract them out for 10 hours a month. I don't know, 5 hours a week, whatever. This is all internal and that's up to you. But anything that you did to build your capacity in terms of staffing, whether it's hiring somebody for 20 hours, 30 hours, 40 hours, or you're just contracting someone out to do like a certain thing, please add this person here. We want to keep them in the loop with all the things that are going on. So that's why we ask for all of this information. And then just remember that it should be in the month that you're reporting in. And once you report that person, you no longer have to report them again. Unless you hire another person the following month, then please add that person as well. Now, I want to highlight a feature here that if I'm going to go back because I don't want to fill all this out. So for the purposes of our training, I'm going to use this back button here, and it's going to take me to the question. I'm going to answer no in this case because in this scenario, the health council did not hire this particular month. So I'm going to move on. As you can see here, you're already on 4 of 10. So you're almost halfway there. So this is Health Equity Committee trainings. This is an example of something that we heard back from health councils and we wanted to make it easier. If your health council did not go to any, I'm sorry, this question is about Health Equity Committee. Oops, I got ahead of myself. All right, so this is your question about Health Equity Committee. By now, I think we're at 96%. So the answer will be yes. And then here, I want to read this. Please attach the Health Equity Committee meeting minutes and the roster with your committee's contact information. I'll make this bigger. And you also want to include their role in the community. Who really brought this to my attention was the tribal health councils were so good about this because they're very diverse in their health equity committees and their health council members to begin with. They've got elders, they've got youth, you have people that live in rural areas. So you really want to make it as diverse as you can. And that's why you want to put what their role is. So after your roster is submitted and you don't have to make any changes, you only do it the one time, unless you add a member or someone asks that they need to leave, then you would submit it a new one, or maybe they updated their email or something. We won't be contacting anyone. It's just for reporting purposes. Okay, so then you also want to do the minutes. Now the minutes is something that you will turn in every month. If you didn't have an official meeting, but you still did the work, let's say your office shut down and you're used to meeting in person outside, weather permitting, but let's say you couldn't do that and just people were sick and so they couldn't even get on the Zoom. So what you do is, you still did work. You did it by phone, you did it by chat, you did it by email, whatever you did. What you'll do then is you'll create a summary. This is not ideal and hopefully this won't happen every time, but this is what we want you to know is that if you didn't have a meeting and you don't have anything official to turn in, then just make sure it includes your health council name, the month that you had the work done, and the members that worked on that took part, and maybe the methods that you used to reach out to each other. And then of course you're going to list the work that was done. You can do it in bullet point form, a short paragraph, whatever you can. Okay, otherwise it's just your equity committee meeting minutes. Okay, so here, this is pretty self-explanatory, but just for the sake of showing you, let's say I keep my minutes in a certain place. So I'm going to go ahead and maybe I can make this a little smaller so you can see what I'm doing. I'm selecting it here and see, this isn't a bad example because I have 3 things in here, but let's say I'm like, oops, I accidentally put in the wrong thing. I'm going to take this out. That's for vaccine, not for roster. And so here, this is my imaginary roster and my minutes. And then of course, in months where you already did the roster, you will only have the minutes. So this is how you turn that in. Okay. And then here, let's say you had an official meeting and everything's in PDF and you finished it and you remembered at the last minute that someone said something and you forgot to put it in the notes for whatever reason. So this is where you would really want to add this. Now, I don't know if we have anyone from Luna County on here, but because I can't see the participant list at this moment, but I was on one of their meetings and they're doing amazing work, by the way. Who isn't? But I got this example from them because it popped into my head. So here would be an example. Let's say they did their minutes, but they forgot to add something in there. So what happened toward the end of their meeting is they're going to have this health fair and they were talking about it. And then someone from the DOH team offered to support them in that. And they asked if they're going to have a mobile vaccine event and all that. So what they would do in this scenario is they're going to add that. We're thinking here, let me make it bigger. We're thinking of having a mobile vaccine event at our health fair. We're working on the coordination with the help from the DOH team. So boom, you got to celebrate and show what you're doing and you didn't have to redo your notes all over again, okay? Also another thing on notes, if you get them approved by your health council, we don't necessarily need the approved minutes. We just need, in draft form is fine. We just want to show for reporting purposes that health equity committees do exist and health councils have been doing this work for a long time. All right. And then so here, this next question is, in what ways does the work of the Health Equity Committee inform or affect the work of the Health Council? And my example is I put, our group is diverse and has many networks. This helps us to include, I couldn't think of a name, a certain rural area in our vaccine planning, or again, I'll use the example of Luna County. They, let me think what it was. Yeah, they know they have a Spanish speaking population. So I don't remember if they established the Facebook page or if they joined into a Facebook page that was specifically for Spanish speaking populations. And what they do is they put their flyers that are in Spanish on there. So do you see, that's diversity. That's thinking of people that may not be included in other resources and promotion. All right, so that's an example there. And then see, we're getting close to the, we're past the halfway point. Here, you're going to enter in the names of the trainings. Forgive me, I need to expand this question so you can see the whole answer. I just realized that as I was doing this. But, you don't have to get too fancy here. We strongly recommend that you go to trainings. It isn't a deliverable per se. So what you would do here is you're going to name any of the training or trainings that your members went to. You don't have to name the members. You just put the training. If it was the first and third Monday trainings for us, you can put the first and third Monday CDC Health Equity Community Rebuilding. If you remember the topic, you can put it there. Put as much as you remember, but again, don't be like, so concerned about numbers of people. And we did have that at the beginning, but it was just getting to be too burdensome. So we're trying to make it easy. So this is what we're doing. Also, please include any trainings that you went that helped your health council. If it was about suicide prevention, if it was about diabetes, put them in there, because as we see what you're interested in, that helps us at the Alliance know what to include in health council talks and other trainings that we have. Okay. So I'm going to go ahead and go to the next one. This is very similar to the health equity thing. This is your vaccine equity plan. And so by now, everyone will have had one. Please pay note to this very tiny writing in here. This helps you to know when things have started and when they're kind of, when you should be submitting. So by now, everyone should have if you're new, then we're working on it, right? But if you are already established, then you're, I think we got like a 94% submission rate. So the only ones that haven't are the new health councils, and that's okay. But we're working on this and we need to get that done. So you'll be reaching out to Geraldine and I, or we will be reaching out to you. So here, you would do yes, and I won't go into it because it's the same idea, but I do want you to read this part here. It says, please upload your vaccine equity plan, which is part one. Part one is the plan of the template that you got. If your plan had updates or corrections, which by the way, the majority of you will, because remember, we're making sure that you have baseline data so you can have a starting point and see your growth. So you're, hopefully Joan will cover that when she has her part. Oh, I need to hurry. Okay, and then you're also extending it to June. Okay, so you will all be updating part one this time around, but then once it's updated and you don't need to change it, then from then on out, you're just gonna be putting in your progress, which is part two. This is really important, and we had about half a dozen that didn't turn in part two, so we need to make sure you're putting in what you did, okay? All right, so we're gonna move along, and here is the capacity assessment. This tells you that by February 12th, you already should have done the assessment, which I think everyone did. I think we actually had 100%. So here you would have put yes, and that's pretty much all you need to worry about for this part here. But we're at the end because we haven't done much on the capacity assessments. We're learning on that more in March. So here you're going to make sure to send me a copy of my response. Okay, and then I'm going to submit it. And do you see here that after I submitted it, it lets you edit your response. Editing your response is going to fix the month that you were working on. Submitting another response is going to start on a whole new month, okay? So you can either edit from here, but let's say that you walked away and the day has ended, and then you remembered, let me see if I hope that you can follow me. Then you remembered that, that you forgot to put something in your report. So you're going to go to your email, which is what you're seeing here. This is my test. This is the email that it's going to look like. And you forgot, let's say you forgot to put the right minutes. You put last month's minutes. So here you're going to go ahead and you're going to go to edit response, and it will take you to the response that you were working on. I can't say this enough. It's really important that you do this, because if you start a whole new thing it's going to send me to, and then I'm not going to know which one is the right one. So you really want to edit the month you're working on if you made a goof. And I would recommend not editing it past like maybe the 8th or the 9th of the month, because by then I'm already compiling everything and we want all your updates to be showing up on the report that everyone else gets, the partners. So if you have changes, do your best to fix them within 2 or 3 days of the deadline of the 5th, okay? All right, so we're finished there. So thank you for being so patient with me while I try to juggle all these things here. So let me see, I'm going to try to go back to the presentation and then we are going to wrap it up and then turn it over to Joan and have some questions. So give me 1 second. Here we go. Okay, so this is where we left off. Oops. And so moving along, I'm not going to spend too much time on here. And the only reason that I'm saying that is because Madeline has not seen any major issues with the invoicing. This is a little bit of an idea of what it looks like. You will turn this in after you do your monthly the reporting form that we just went over. And you basically are confirming what she put in there for you. If you have never seen this before, that means that you just signed your contract. She is really good about sending it the week before. And here are the things that she does. She puts in your name. You want to confirm that, easy peasy. Here is an idea in this section here of what you will be turning in for the month. Remember, and these little indented parts here will give you an idea of what you need to put in. Okay, here is the beginning and ending period. Ideally, you're doing it 1 month at a time, but for those of you who are catching up, you might be putting October to February here, okay? Here is the amount that you're going to receive for each month that you worked. She will be filling this in for you. You don't have to worry about it. I think it's the easiest invoice we've ever had, or that I've ever seen, actually. And then next we are going to the bottom portion. I'm sorry, I'm breezing through this, but you're just gonna, this is where you're gonna sign. We do have a video available. If you're interested, please place your interest in the chat. She shows you how to do this electronically, but if you, because there's free software to do it. So we'll get to that in a second. Here's the amount that you can be expecting at the end of the month, because it takes about 25 days to get your check. Okay, and then here's the part where if you get Acrobat Reader's free sign and send, so you can probably Google that and upload it, then you could sign your software and send it to her that way. But if not, you can also print it and sign it and either scan and email it back to her, or you can take a picture with your cell phone and send it via email that way. Make sure that you remember that the invoice goes to Madeline and the report will automatically come to me. All right, so sorry, I didn't mean to jump the gun here, but the last thing that we have is, I just wanted to show you that you can find everything you need on our website, but you don't really get used to it until you start using it. So you would find it, here's our page. It will take, if you go to this picture with the people, it will take you to the page and you can access materials from past trainings. And when you get this presentation, it will take you directly to this page. Okay, so let me see, I think I have one. Okay, so let me stop sharing. And Geraldine, can you help me to know if anyone asked any questions that I did not cover?
Yeah, Susie, no questions in the chat right now.
Okay, maybe that's a good sign. Maybe we covered everything. But yeah, I didn't get a chance for everyone to introduce themselves, but I do see some folks here that I've never met before. Hi, Cassandra. Welcome. Cassandra just started. Kayla, you just started as well, didn't you? Oh, excellent. Okay, well, listen. Oh, hi, Rosalie. There's Rosalie. All right. Okay, let me make sure. I just want to let you all know that if you don't make a meeting, like one of the, like this one's a good one that you can put in your report for February, right? But let's say you missed one of the first and third, which are so important because it's going to help you know what to do with your deliverables. Otherwise, you're going to be lost. But let's say you miss one, but you go back and watch a recording, that counts. So when you go in to put in your, what you did, then you would put in that you watched the recording. Okay, so I'm going to pause and let Brenda ask her question. Hi, Brenda.
Hello. I was wondering if you were going to talk about part 2 of the plan, because that's where I was so confused when we talked the other day.
Okay, no, and you know what? I have shared that with everyone, and so I will, but you know what I'm going to do? Just because it's a little bit more intense, what I'm going to do is I I'm gonna turn it over to Joan, and then at the end, if there's no questions, then I will share screen. I have it ready because I want it, just because you helped me with that, Brenda, I have it ready to show other people. So let me pass it over to Joan, and then at the end, we'll touch on the second part of the vaccine template. Thank you so much, Brenda, for your patience and for bringing that to our attention. And then the only other thing I wanted to say, touching on that, is let's see. Oh yeah, I think I already covered that. If you make a mistake on your Google form, just make sure that you're editing and not turning in a brand new thing. Okay, so let me see. What do we have here? No, oh, Vanessa, I'm so sorry. Yeah, I feel like there's so much information that I have to share, and sometimes I'm like, oh, I forgot to tell them that. So yes, if you watched it, and it's kind of nice when you watch them, because let's say you're like, okay, I understand what's happening with this, but I see on the agenda that they covered how to update the first part of the vaccine plan, and that's really what I'm curious about. So then you could go back to the recording and just watch that first part. And yes, it counts. Wonderful. No problem, Vanessa. Okay, so if we don't have any more questions, excellent turnout today, everyone. Okay, yeah, so I'm gonna go ahead and turn it over to Joan. Thank you, Joan, and Emily as well.
Hi, thank you everyone for having us. We understand that there's a little bit of a confusion in using some of the data dashboard stuff, so we figured we'd try to run through it again. It's a lot to take in at once, and I know this is a very novel thing to start to try to learn how to use, so we'd love to just do a quick refresher here, and then we can get to the other questions that you have for all the other reporting and activities you're doing for this grant. So I'm going to share screen. This is our base site. So we are the data department for CHI. We're known as the New Mexico Community Data Collaborative. And of course, CHI is the Center for Health Innovation. And we are the ones who developed the data dashboards for the vaccine equity component of the project. And they have COVID data as well as equity data that will help you into the future and into the subsequent years of the project. But right now we're trying to focus a lot on the COVID data. So I can go ahead and I can put this URL in the site if you guys want to navigate and explore some of our other content. And I'll just give you a really brief introduction. So we focus a lot on building community capacity. That's like teaching people how to do this kind of thing, which is what we're going to do year 2 with the health councils. We'll teach you guys kind of how to update some of this data and make it stay really relevant for you and your uses. So we've got an about page. These are just examples of some of our other products. There's lots of different types of things. The dashboard is what we did with you guys. We also did the health profiles. This is another older version of another dashboard. It was a really comprehensive one we did with Bernalillo County. And then just a lot of different maps that we put together to kind of compare for some vaccine site planning information. And then this was another project we had done with the Office of African American Affairs. So what we have done for you guys, this is our big resource of the 39 dashboards we created for each of the participating health councils, and also links to the health profiles we created for each of you guys. So the health profiles are a little bit more specific. They go over some of the equity indicators selected, and they give you a little bit more data about that, of course, in visual form, and they kind of take you through the story. And then if you want to just look at the COVID data, sometimes the dashboards, they have so much data on it, it takes the internet a while to load it. If you're having trouble like that, but you just need the COVID data, try this column while you look up the link to use for your specific county, because it will load easier. And then here's the full dashboard link. So Susie said we should probably try to use one of the rural counties as an example. I've got 2 examples up because we're in the process of updating these. So I'm going to start with Quay County. So what you do is you go ahead, you can see I kind of searched in the find bar to find Quay, and then you go ahead and you click here and you can get the COVID dashboard or the full dashboard. So I'll start with the COVID tab. And again, this is what I mean by loading, because I have so many tabs. It's not even loading the vaccine hesitancy tab here, but I can show you that on the next dashboard site. So here we've got fully vaccinated. We've got the number up here in the corner. All of our sources, they're what's publicly available. So a lot of it, sometimes it's federal data sources. So most of our data is like CDC, John Hopkins, that kind of thing. And that's why we were telling you the DOH sites that they're putting out are a good adjunct to use to what we've been doing. And thank you, Emily. She just posted the link for this one here. So, and if you want to follow along, I can post the link for this one, but we're going to be moving through a couple of these as well. So, and then this will tell you the percent of the county that's fully vaccinated based on these numbers. And if you need the numbers for reporting purposes, this will tell you the week it was updated. So it's really nice. This says it was updated on the 22nd of this month. So you know how recently, and then these are the numbers we have, and we have some age breakdown, and then we have percents and numbers of fully vaccinated. This one I can show you on, let's see, I click over here, it actually loads. This one has the vaccine hesitancy data. I just switched to the full dashboard site. But if you go ahead and you click on one of these areas, there's a little typo here. It's supposed to read the week of 1/20 to 2022. So this was the last week in January, was the most recent data that we got for this. But it tells you what respondents were hesitant. So anybody who didn't say, yes, I will definitely get the vaccine, was regarded as hesitant, even if they said, yes, probably, because they sounded wishy-washy. So basically, this will tell you the percent that expressed hesitancy. And these areas, it's nice because it was sub-county data, so it's not just Quay County as a whole, and it has the zip code that it was actually corresponding to. And then this is where we got the data from if you want more information. A lot of these, again, since there's a lot of good adjunct sites, we try to include links to that as well. DOH has some good information about the vaccine at Get the Facts. And there was really good information for the health workers, the CHWs. And they had put some good educational materials up that the CHWs found helpful early on in the project. So we have a link to that as well. Anytime you see these little arrows, that means, and then there's more. So we'll start with what's here, and then we'll go to the and there's more. If you look here, the little dots in the corner, go ahead and click on it. That's the legend. And then that'll tell you what are all these squares and colors mean. So basically you see a red square here, and that's going to be a private practice. And how you get to that, I'm going to click this off real quick so we can get to it, because this is the vaccine hesitancy we talked about. Again, more carrots here. So we keep going, and then we start to actually get the different sites that are there. So we have the Vaccine for Children site, and then we also have another one, and this will tell you the hospital site as well, and it'll give you the address, zip code, any information that we have on that. But these are the different types of Vaccines for Children program sites that we were able to identify. We've got the tribal and the county boundaries, which helps, again, for reporting purposes. You can see which different sub-county areas correspond to your particular county or tribal area. And then you're wondering, what does all this light and dark coloring mean? So the dark coloring in this instance, it means there's a high percent of hesitancy. So it means people were more hesitant than in some of the other lighter areas. If they had a low percent hesitancy, then they had a really light color here. So that gives you some info about that map. You go ahead and you click here, and there's lots of different things that we tried to map for you. We put in a couple maps. A lot of times they're layered on top of each other, so you'll see like 2 or 3, but you can go ahead and you can click on the county again. And there's a lot of information here. This one is trying to show cases versus deaths. So again, if you click on the legend, it's actually not populating right now, but it's supposed to populate and tell you what the different colors mean. But if you need the different numbers for like case numbers, death numbers, that sort of thing, it's good to kind of scroll through here and see if they have the what you need for reporting listed. We have a lot of different percentages, raw numbers. We try to break it down by ages when we can, and lots of different adjunct information, like how many beds do they have in the hospital, how many are ICU, how many ventilators. that sort of thing, and different social determinants, since that's kind of what we're looking at. We want to overlay all this different COVID and equity data with the social determinants of health that we know affect health in so many areas. So we have things like poverty rate, unemployment rate, median household income, things like that. So, and we're only halfway through. We tried to break it down by ethnicity too. Yeah, go ahead.
I just, so I wonder, because we have a lot of new people on here.
Yeah.
And so, and then of course, our main thing was that they couldn't, you know, like they either overlooked or maybe didn't know how to find their baseline data. So if you're Quay, let's just use Quay because we've already on Quay. Let's say Quay needed a baseline data to go back from December. I'm not sure what their target population is, but can you show us a quick, easy way when you click on the dashboard, where's the first place you would go to find your baseline data?
Okay, so if you're wondering about prior data, some of these things, basically, if you guys remember, we sent everybody links for, there was a private map that had like sub-county zip code level data. That one we're trying to trend forward. And ever since we started getting it, I think it was in December, and we're trying to trend it forward so you can see, like, it depends on the baseline data you're talking about. Because if you're talking about percentage of vaccination, we're doing that by zip code in that private map, and we're trending it forward. So you'll be able to go backward and then see, basically based in what's December as a reference, before any of the activities started, you can see kind of what the vaccinations were in that period of time. And then you can kind of carry it over, and you can even look at the sub-county area that you were targeting activities at, which can be useful. So that's a different private map for that component of it. A lot of this is mixed here, where it's talking about COVID data, like case rates versus vaccination rates. So you have to kind of see which data that you want to look at, because this one's COVID data, and this is still COVID cases versus SVI, the social vulnerability index. It's something the CDC put out that happens to mention New Mexico is very vulnerable to things like pandemics because of different indicators that they took into account. But basically, the whole state is highly vulnerable to adverse effects from things like this pandemic.
Okay, so and remember, I don't
Yeah,
really
go ahead.
know that much about this, but so are you able to show us, like, and I don't know, could you go in and like say, yeah, I'm trying to think, like, let's say folks targeted ages 24 to 44, and they want to know the vaccine rate, their baseline data in December. Is there like just like a quick, easy way to do that? And are you able to share it? Because I know some of the zip code stuff was maybe not shareable or something like that.
Yeah, the zip code stuff wasn't shareable. Some of the data, we have some here, and then other pieces of the data are available. Let's see. I'm going to stop share real quick.
I didn't mean to get you over flow, Joe. I'm sorry. I know
No,
that.
you're fine. This is what people really need. So thank you for the redirection. Let's see. Other pieces of the data are on some of the DOH sites as well. So let's see. Gosh. Okay. Emily, do you want to show him where maybe the best place would be to look at the county level baseline vaccine data from December when they started, to maybe moving forward into the coming months? Like the easiest one-stop shop place would be for something like that.
Sure.
Okay.
So right off the bat, about half of the counties will have that in their COVID dashboard. The Quay County one doesn't have it. That's one of the counties that unfortunately doesn't have it. But we will have for about half of the counties. Here's an example here. Otero County has a line graph, so we do have some trend data in there. for cases, and this goes back a handful of months, and this is broken out by those different populations. So if you hover, you'll find that we are working on a trend, and let me see if I can find a link to that. It hasn't been added into these dashboards yet because it was kind of a recent, more recent feedback we got about what would be most useful.
Yeah, I'm trying to remember some of the DOH sites, they have county level vaccination data. And I think some of them you can go historically. So I'm trying to pull up one of their dashboards and see if I can navigate to that, just so you quickly have a resource that's already up as we start to populate that.
That would be so helpful because they're,
Yeah.
you know, we on the 7th of February, we were asking for them to make sure they included that. And so now they're working on the report, so that'll be really helpful. And then we have a couple more questions, but I'll wait for you to answer this.
Yeah. So I'm looking at this and it looks like the vaccination data, some of the COVID data, I know they have historical things. And then the vaccination data that looks like the stuff you can navigate to is the current vaccination data. And let me click on the counties and it doesn't look like it has the historical component in here. So it was probably, again, the same thing that we found where people were keeping better track of the historical COVID numbers and trying to trend them up and down, as opposed to like the trending on the vaccine numbers. But we're trying to complete that as well. And let's see.
If it would be useful to have just like a standalone, like December, if December is the month that we need baseline.
Yeah, that might be the most useful.
Oh, wow. I can't, that's, my mind just went, woo, that would be great. I mean, yeah, really, because that was when we started it. And most health councils are doing some COVID related work, whether it's about vaccines or, you know, anything else. So that would be really great. And then just maybe sharing that in such a way so everyone gets that and it's very clear. Yeah, because I mean, if it were me, I literally would have to have a sheet of paper that says, Susie, if you want your baseline, click here and then look here.
Yeah.
That's how I roll. So I don't know if anybody else is like that, but
Susie,
yeah.
There is a question in chat from Ursula. So for reporting purposes in our February reports, do we need to add this data?
So it depends, Ursula. I can't remember if your county was one of the ones that had included your baseline. So basically, I don't know if you'll remember, but on the 7th, Geraldine had a part where she was saying how we wanted to maybe improve the vaccine plans. And so there were a majority of the health councils that did everything right, but they didn't put a starting point. And we are not able to measure. So like if it's our Hispanic population is 60% vaccinated, we're hoping to make that 70% by the end of June. That's what I'm talking about. So if you've already done that, then this doesn't apply to you at all. But if you have never put in a baseline, like a starting point, that would be in a number form, like percentage, then yes, this is what you would need to do. There are a couple other questions, but that was a really good one. Thank you.
So if we can get to some of the other questions, I think that may be a better use for this session.
Okay.
Let's see. Okay, so Brenda's saying we've got more updated hesitancy data. Yeah, it was really nice. They posted that. And Quay County had a 23% hesitancy, and that when they talk to people, it sounds like they have a higher hesitancy. So yeah, this is just basically what people saw in their survey. So there's always biases in different surveys. It's biased towards the people who actually answered that survey. So you may have a more broad representation of people talking to you, as opposed to people who happen to be the ones that they were able to contact for the survey. So, and it is kind of sad that sometimes you get a widely different answer, but the best data collection methods we have sometimes still don't get a completely representative sample. So you having personal relationships with the community may get at a different section of the population that wasn't really participating in the survey. So that's good information that you have that you can carry forward.
There's another question that inadvertently came only to me. And it says, is this tool mostly to see what area needs to be targeted in regards to the vaccine? Our county has moved quickly with pushing things out, so we have moved beyond vaccinations and are now focused on preventing the spread by disseminating at-home COVID tests and providing appropriate literature materials for community members.
That's wonderful. So a lot of this data, it's basically for however you see fit. If you see a large discrepancy, like within the county for the sub-county level data, it's like, okay, well, most of the county is like seeing different metrics here. And then like, let's say, for example, I'll just share the screen again. Let's say half of the county or something was dark here because they actually had high rates of hesitancy. And then let's say there's a corner where it's actually really low rates of hesitancy. So then you can kind of see, okay, well, is there like a pocket of people we haven't really accessed or something like that? But yeah, that's wonderful if you're actually able to progress beyond that and go to prevention, because that's what everybody wants to do in the end, because then we kind of avoid the problem in the first place. So if you can progress to that point and you're already there in your plans, that's wonderful.
I agree. And so just to reiterate, you guys are going to kind of work on maybe finding it's almost like, yeah, like something that's for people that don't really understand data too much, but they want to show like a starting number of where they were in December. And then how would it be like by different age groups, by race, or how is that sounds like a lot of work. Would that be something that you guys could easily do?
We've been updating these data sets. And so the way we've been doing it is kind of like pushing out the old data and replacing it with the new data. So we have that somewhere. So we just find it and we can put it up. And it will be at whatever granularity is available. It's probably going to be by ages.
Okay, that's fine.
Yeah. So the demographic group, those demographics by race is available again for a subset of counties, unfortunately. And that's just because I don't know why, but that's all that's available. And we're getting that through the CDC. But overall, you should at least be able to break it down by age groups.
Got it. That's something, right? And so, and how will you let us all know? Is that something that you want to just share with, I don't know, myself and Madeline, then we could disseminate it to the health councils or something like that?
Yeah,
We
that'd
can
be
do
great.
that.
Yeah. So when we get that ready, we can give you the link for the map, and then everybody will be able to navigate that component to make sure that you have baseline data, and we can title it something like baseline data for vaccine equity project, like baseline vaccination data.
Wonderful. Okay. I mean, I don't even know if that's the whole answer because I know everybody's chosen different targets and stuff, but it's,
Okay.
That's very helpful. Thank you. So I'm going to leave this.
Yeah.
We have a few more minutes, but I'm willing to stay
Yes.
after for anyone who wants to, but I want to let Joan, would you like to wrap anything else up?
It's okay. I know there's lots of other questions. Brenda had other questions, and I know that would benefit the group as well. So I want to make sure to leave time for what the group actually needs right at the moment. And we will keep you guys updated and give you the new trending map as soon as it's complete.
Thank you. Okay.
Yeah.
This was so great. I appreciate that you guys came to help us out. Okay, so my goal now is to share my vaccine template, and I hope that I can do it because for some reason I am not seeing it on my options. Here we go. Okay. Okay, can everybody see my vaccine equity action plan? I don't know why it does that. Okay, all right, so I'm assuming you could see it. Okay, so I'm just gonna scroll here so real quick, the part where you're extending your date is right here where it says describe event, describe event or activity 1. And so you're just, you're just extending it to June, whichever one makes the most sense to extend to June. Okay, so that's that. your baseline, okay, here we go. Here's your priority population. And then your baseline is right here in this second line. What's your expected outcome? What is your baseline measure? December 2021. And what is the measurable goal? So that's where that part's going to go. Okay. Because we just need something to measure. And then I'm going to just scroll down here. We updated this, by the way. It's on the website under past training materials that I showed you earlier. And here is part 2. Real quick before I get to Brenda's question, and for those of you who have to leave, I understand, that's okay. This will be recorded. But we updated the sample here so that you can see. So before we had it only where the first one, they were both to January, but as you'll see, activity or event 2 has been extended to June, and you can see here how this individual has extended all the target dates through June. It really should be easy. It should not be complex. But if you need help, please reach out to me. All right, so I'm going to scroll back up here to part 2, which is your progress. And here we are. And Brenda, let me know what your question is.
You answered my question the other day when we talked. It was about where to put the other things that aren't these little things here that you asked for that we are doing. And you said to put them here under this other.
Yes, can you refresh my memory? I'm sorry, I can't believe I can't remember that, but I do remember it was such a good point. Can you give me one scenario of you're like, we're doing this thing, but I don't see it on this list. Can you give me one or two?
Well, a lot of what we said we were going to do in our action plan was to reach out to the clinics and talk to them about what they offer and the parameters and all that. And we didn't have any place to report that we had done that.
Okay, so then I was like, okay, Brenda, let's find it. So we're going to find this place. So it's not an email blast. It's not social media. It's not radio. It's not print. None of this. So then it really fell under
Other, because we were gaining information for promotions.
Yeah, so whatever makes sense to you, you're going to put it in there. And it'll cover it. And then here, you're putting the number of activities and the people reached. And if you wanted to put a little note here, you can certainly put it in next to other promotional activities. You can also add another column, and you could do that too if you see something that doesn't really fall under the category. But everything is either under promotion, planning coordination, or the actual thing that you're doing. So Brenda, were you the one that had an additional question, or was there someone else that wanted to go over this?
Well, when I said that earlier, I just said that you should go over it so everybody else understood what to put there in the other.
Okay,
so I didn't have another question.
Okay, no, that's good though. But I hope that helps people because yeah, maybe it doesn't say exactly what you're doing, but you're just looking for the thing that matches one of these main categories. And if you don't see it and it's just like, nope, that absolutely does not fit, that you're just going to add it in this little line here on the bottom. But yeah, okay, so I will, I'm going to leave this up for a second. I can't see the screen. So if anyone has a question, raise your hand or just let us know or add it in the chat about the vaccine template. I'm scrolling slowly down.
Susie, I think just to clarify too, maybe if some or maybe be confused. So for each month that you upload your vaccine equity plan, you'll always be updating part 2 to reflect the type of outreach that's been happening, right?
Yes, thank you. I think I breezed through that a second ago. It was too fast. Yes. So you remember how when you do the roster in the minutes, when you did the roster, once you have it done, it's done because that's your members. Same thing with part 1. This time, a lot of you will be updating part 1. If you didn't have your baseline and you didn't extend till June, you will be updating part 1. But once that's done, unless something has changed, you don't need to upload part 1 again. So if it's changed, like maybe one of your partners, you're partnering with a bank and then they decided that they weren't going to do it anymore. So then you have to change, right? But for the most part, after this part 1 has been submitted, what you will be doing is mostly updating. So I foresee this happening in March. From March on, unless you have any changes, you will be updating this part 2, which is your progress report on the things that you have done. Good question, Geraldine. Thanks for clarifying. Anyone else? No? Okay, I am going to stop share. And wow, we are right on time. Any last comments about what you would like us to cover the next time? We typically will look at the chat and review all the notes and see what we can add. but does anyone have anything that would help them with this project that they just, maybe need a refresher on or anything like that? We are open to suggestions. You can either put it in the chat, say it now, or email me and just let me know. Let me put my number in here if you want to call. Okay. All right. Anyone? No? Okay. Well, welcome to all the new people. And thank you so much for joining us and bringing up all these amazing questions. Geraldine, thank you for support. Joan and Emily, oh my gosh, yes. Anything you could do to help us. If anybody's as challenged with data as I am, I'm just so happy that you're here. All right. Thanks, everyone. Everybody have a great day. It's Friday. Woo! Okay. See you later. Bye.